Hi, everyone. My name is Stephanie Dietz. I'm going to be talking about my project, Automated Speech Analysis, to reveal early biomarkers in Parkinson's disease. So just for a bit of background before we get started, Parkinson's disease is a neurodegenerative disease that's characterized by a decline of cognitive and motor function. It's extremely common. It affects approximately 10 million people globally. And in the US alone, the death rate for Parkinson's has increased by 63% in the past 2 decades. There is no known cure for the disease, but with treatment, disease progress can be slowed, which is why early detection of Parkinson's can be really beneficial. The earlier that the treatment is started, the better that the patient outcome will be. The problem with this, though, is that diagnosis can take years and multiple interventions, which is a process that can be unaffordable or unattainable for a lot of people. So identifying neurodegenerative biomarkers to improve diagnostics and treatments for the disease before significant cognitive and motor decline occur is extremely beneficial. The basal ganglia is the primary neurological structure associated with Parkinson's disease. And this structure is involved in the planning, programming, and execution of motor tasks. When the basal ganglia is deteriorated by Parkinson's disease, we can see the hallmark symptoms like tremor, rigid muscles, slowed movement, and speech abnormalities. 90% of people with Parkinson's experience some degree of speech impairment. And with that in mind, Hlavnica et al., the original study that I procured my data from, sought to determine if an automated speech analysis examination could distinguish the subliminal speech pattern impairments present in individuals with neurodegeneration. And this exam would be able to detect these impairments far earlier than other diagnostic methods are capable of. Using vocal assessments with speech as a biomarker has advantages over a lot of other diagnostic methods, given that it's inexpensive, non-invasive, and potentially applicable to a lot of people. So my research questions for the topic are there specific speech variables that are strongly associated with early biomarkers of Parkinson's disease as identified by the automated speech analysis exam? And is a reduced model comprised of these variables able to classify disease presence more accurately than the full model used in the original study? All right, so moving on to the data, it was collected at Charles University in Prague. The study used 3 participant groups, individuals with Parkinson's, individuals with rapid eye movement sleep disorder, and healthy controls. Rapid eye movement sleep disorder patients were used because the disorder has been established as a prodromal syndrome for Parkinson's. So basically, testing diagnostic processes on these RBD populations helps us assess their potential to detect early neurodegeneration. Researchers had participants perform a speaking task to demonstrate speech impairment. They were instructed to read a phonetic text of 80 words, and then 12 acoustic variables were developed to assess the 4 basic subsystems of connected speech, which are phonation, articulation, timing, and respiration. For the purpose of my analyses, Parkinson's and RBD participants were both coded with a value of 1 corresponding to disease presence, and healthy controls took a value of 0 corresponding to disease absence. So this figure here is just meant to display how each of the 12 speech feature variables are connected to the 4 basic subsystems of speech. So the speech recordings from each participant were analyzed by an algorithm that output values for each of these variables, and those values were each standardized and compared in the analyses. All right, so then a random forest model was applied to determine which, if any, speech variables were more strongly associated with the presence of neurodegeneration in an individual. Optimal tuning parameters were established, including the number of decision trees used in the forest and the number of random variables used in each decision tree split. The random forest model contained 500 decision trees, and 3 random variables were tried in each split with an out-of-bag error rate of about 25%. The data set was then applied to the model where the importance of each speech feature variable was examined using mean decrease in Gini values. Speech features with high importance, in this case, with mean decrease in Gini values above 4 were used in the reduced model. You can see in the table here that these two bottom rows, both duration of unvoiced stops and pause intervals per respiration, had mean decrease in Gini values below 4, so these were removed from the model. All right, so the remaining high importance variables were used to generate the reduced model. After conducting the logistic regression analyses, I used a likelihood ratio test, deviance, ROC AUC curves, and AIC values as metrics in which to compare the model accuracy. The likelihood ratio chi-square test was not significant with a p-value of 0.179, which indicated that the reduced model performed equivalently or better than the full model. The residual deviance of the reduced model was also lower than the full model as well. But we did see that when examining the ROC curves and the AIC values for the models, the full model did perform slightly better. So for my overall findings, the random forest model revealed that phonation and timing were the subsystems of connected speech that were most disturbed by Parkinson's, indicating that they hold the highest predictive power for disease presence. Future research into analyzing speech as an early biomarker for predicting Parkinson's should place significant value on those two subsystems. Next, based on the analysis of the random forest and the comparative evaluation of the logistic regressions, we can conclude that the reduced model of high importance speech features could serve as a computationally more efficient model for detecting neurodegeneration because it provides improved efficiency that can be beneficial in resource constrained environments, like a mobile device with limited processing capabilities. And this is important considering that the overarching goal of the speech exam is to develop a widely accessible and remotely administered exam. So yes, then overall, the results of the study supported Hlavnika's findings. An automated speech analysis exam has the potential to revolutionize the diagnostic process of Parkinson's. And it does that through identifying these early biomarkers far before healthcare professionals are capable of. All right, so future directions. Future research should focus on a more representative sample. Descriptive statistics showed that there was a significant gender disparity in the participants, with women consisting of less than a third of the sample. And although this disparity is consistent with previously recorded gender-based prevalence rates for both Parkinson's and RBD, due to sexual dimorphisms between men and women, disease progression and symptoms greatly differ. So the model may not provide an accurate representation on those gender differences. So yeah, reproducing the sample would help determine if the exam itself is effective for both genders. Future research would also benefit from collecting the vocal data in a non-laboratory setting. The initial study has a high potential for suffering from low ecological validity. The reading of the passages that participants did were in a soundproof room with a professional microphone. So future research should conduct that reading of the passage in a non-laboratory setting where participants complete the exam from their home using a smartphone to see if the results are applicable and can be generalized to the real world. Additionally, the data set used for the original study was procured from the Czech Republic, wherein all the participants were native Czech speakers and all of the reading passages were spoken in Czech. And so since it's been established that speech characteristics and natural rhythms differ between languages, this means that the specific speech dimensions for the algorithm used in the initial study wouldn't produce accurate results when applied in other languages. So future research would benefit from rescaling those dimensions to represent the common speech patterns of healthy speakers. All right, thank you.